Over 81% of the eligible population have had their first dose, and under 400,000 doses are needed for us to reach our target of 75% fully vaccinated. This is an incredible accomplishment, and thank you to all Ontarians. But we must do more in the face of the Delta variant. For the last several weeks, I have been unwavering in my pleas for all eligible Ontarians to step up, roll up their sleeves, and get vaccinated. I said time was of the essence, but now that time is here. We must take assertive action to protect the health and safety of all Ontarians, especially as we move closer to a return to school and the cooler weather drives us indoors. The policies I am announcing today are an important link in the chain of protection that will help keep Ontario strong in the face of the fourth wave. The Delta variant is more transmissible and has resulted in a reintroduction of COVID-19 in some high-risk settings, such as hospitals, home and community care, and congregate settings. These are settings where individuals are at a higher risk due to age or their health conditions or comorbidities, and we need to better protect them. That is why I am issuing a directive to require COVID-19 immunization policies in hospitals, home and community service providers, and ambulance services. Effective September 7th, the directive will require covered organizations to implement policies that require their employees and others in these sectors to either provide a proof of full vaccination against COVID-19, provide a documented medical reason for not being vaccinated. In addition, covered organizations will be required to offer an educational session about the benefits and risks of COVID-19 vaccination. In cases where individuals do not provide full proof of vaccination, they will be required to undergo regular testing and demonstrate continued negative results. This directive outlines the minimal standard that is expected. Should an organization choose to implement policies that go above and beyond, they will have the authority to do so. But policies for these sectors is not enough. That is why we are intending to proceed with vaccination policies in other sectors, including congregate care settings, such as residential and community services for adults, and community-based service providers for children with special needs. And as the return to school approaches, vaccination policies in our educational sector will be crucial as we look to minimize the impact that COVID-19 could have on our children, youth, and young adults. In support of the province's robust return to school plan, the Ministry of Education is finalizing a vaccination policy for all publicly funded school board employees, as well as staff in licensed childcare settings, with rapid test requirements for staff who are not immunized against COVID-19. The government also intends to proceed with requiring vaccination policies in post-secondary institutions and in retirement homes. This builds on the great work of many institutions, such as Seneca College, Ottawa, Western, Queen's, and Toronto University, who have already implemented immunization policies. More information will be made available to all of these sectors in the coming days and weeks. Another important step is that province will offer a third dose of COVID-19 vaccines to most vulnerable Ontarians. Specifically, this includes those that are transplant recipients, individuals receiving treatment with an anti-CD20 agent, patients with hematological or blood cancers who are on active treatment, and a third dose can provide an improved immune response for these individuals. But it's very focused and narrow in the eligibility criteria. The province will also be offering third doses to residents of high-risk congregate settings, including long-term care homes, high-risk retirement homes, and First Nations elder care lodges. And starting tomorrow, all children turning 12 years of age before the end of 2021 will be eligible to receive their first dose of COVID-19 vaccine and can book their appointment through the provincial booking system or through their local public health agency, or can walk into vaccination clinics across the province. Finally, we are pausing our exit from the roadmap to reopen. We need to get the vaccination policies in place and our vaccination rates up. I know what has been outlined for you today is a lot to process, but this is what we need to do to protect Ontarians. We are continuing to follow the data and the evidence and keeping a low rate of infection in our communities and building community immunity will protect our most vulnerable and keep our schools, our businesses, our social settings as safe as possible and minimizing further disruption. I want to take this opportunity to thank Minister Elliott and Premier Ford for their ongoing leadership and support as we continue to protect everyone in Ontario from COVID-19 and the variants. We need to be proactive to avoid the reactive closures that result in significant impacts on our mental, physical, social, and economic well-being. Every shot in arms is our best shot out of this. We can do this, Ontario. I'm happy to take any questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Randy Rath with CHCH TV. Please go ahead.
Yeah, hi, Doctor. This question is probably best posed to one of the ministers or the Premier, but they seem unwilling to talk to me today. Why did this take so long? School starts in 3 weeks. It takes 6 weeks minimum to become fully vaccinated. Surely you've known that for a long time. Why now? Why hasn't this happened before?
Thank you, Randy, for your question. So we've been monitoring the evidence and we've been monitoring our immunization rates. We had a sudden drop-off over the last several weeks. And quite honestly, we have to re-bolster our efforts to immunize Ontarians. It was unexpected to have such a sudden drop-off. And we've learned more about the threat of Delta. It is now over 90% of the detected samples are of the Delta class or variant in Ontario, and we're now seeing our rates of illness go up. And we're seeing our hospitalization numbers go up. As a result, we are now making these recommendations on immunization policy. I still believe there's significant time for this to have its desired effect, that Ontarians continue to embrace immunization as our ticket of safety over the next coming months, where Delta is going to try to rear its head and spread rapidly. We just have to look around in other provinces in the southern United States where Delta is really taking hold. I think this government's taken a cautious approach. We're staying in step 3. We're now embracing immunization policies. I think you can recall that several weeks ago I did say the clock is ticking 42 days before school was supposed to start and clearly called on Ontarians to come forward. We're making progress. It's just not quick enough, and I think these immunization policies will better protect Ontarians against the fall and are heading in the right direction. If you have another question to follow up, I'm happy to try to answer.
Follow up?
Okay, thank you. When you talk about regular testing for the unvaccinated to go into their workplace, what do you mean by regular testing, and how much do these tests cost, and will the onus be on the unvaccinated to pay for the test?
Good question. So there'll be no cost for the test. Most of the funding for these antigen or rapid tests are from the federal government. We have ample supply. These are being distributed to our partners as we speak, and the instructions on how to use them are being detailed. So there's no cost to the patient, the client, the end user, and the federal government at present is paying the cost for their implementation in Ontario. The confirmatory test, if it's positive, would be the responsibility of Ontario and would be a PCR test. The frequency of the testing will be following the risk in the community in which the individual lives or works. And at a minimum, it would be once a week. It would escalate to up to twice or 3 times a week, depending on how Delta is spreading in the community. My preference is that any individual embrace immunization as the strategy to best protect themselves, their community, and those that can't be immunized, especially children under 12 years of age and those that are older who are still vulnerable due to their immune status. Immunization is the best decision to make, but if despite you make that decision not to be immunized, we need an alternative such as testing, and the testing frequency will be at a minimum of once a week and escalate based on community risk.
Next question.
Your next question comes from Alex here with Globe and Mail. Please go ahead.
Hi, Doctor. Just want to follow up on that previous question. Just want to know how frequent testing can be done, especially if we escalate up to 2-3 times a week without having unvaccinated people miss school or work.
Yeah, so the rapid test can be done at a time of entry, or it can be done in advance. It is rapid, so the turnover and results can be within 20 minutes. And we are working on methods to ensure that that can be done rapidly at entry points. The testing strategy is one component of a multi-component strategy. Clearly, we hope that individuals embrace immunization as the preferred choice, but we needed a backup if they didn't. And the rapid antigen testing is accessible, available, timely, and we have enough equipment to be able to distribute all across Ontario as needed.
Follow up.
Thanks. And I'll follow up, just wondering if we have any data on the percentages of hospital workers and education workers and how many of them might be vaccinated.
Total information at present, it's not well documented in the COVAX system where we document immunization status. So it's anecdotal by survey. If you recall, we've done surveys, the professional associations have done surveys, so physicians are well over 90% have adopted first and second doses already. I'm sure that number's going higher and higher by the week. I've heard anecdotal information of 80% on average for workers in acute care facilities, but it can be low as 70 or 60 depending on what workforce you're surveying. So what we need from a patient perspective is that any point of exposure in a healthcare sector can put you at risk. And so we need all workers in those environments to rise up and have the highest immunization rates possible. As you recall, over the first, second, and third waves, we did have outbreaks in the acute care sector. We did have transmission, and we frankly, sadly, have had deaths. These are avoidable. They're preventable. I think the CEOs, the workers in hospitals want the safest work environment, and they want the safest environment for their patients, many of whom are immunosuppressed. They're getting their cancer therapies. They are getting their cancer surgeries. We can do better. We can have higher immunization rates. I hope the workers embrace this immunization policy as a nudge. But if they don't get immunized, we need also to have a testing strategy to best protect those patients. I'm happy to say that many acute care facilities have already adopted policies and are willing to go even further. And I fully support the best protection of patients across Ontario in the acute care sector through immunization policies.
Next question.
Your next question comes from Chris Herhold with CP24. Please go ahead.
Good afternoon, Dr. Moore. About COVAX, who exactly has access to COVAX to determine someone's vaccination status? And will that be accessed only in settings deemed to have an outbreak? Because what you said earlier about about vaccination status and self-isolation rules in school settings, it strictly differentiates those who are vaccinated versus those who are not.
Yeah, so the information custodian for COVAX is the province, so it would be under most likely under the Office of the Chief Medical Officer of Health. The health units have access to COVAX in the event of an outbreak and can use it as a tool to ascertain the immunization status of individuals for whom they are actively investigating an outbreak.
Follow-up?
Okay, just about the rapid antigen. Even at the lowest known bulk prices of the kits that the federal government has procured for us, this will eventually amount to hundreds of thousands of dollars per week. So why is the government, why are we committing to picking up the tab indefinitely when other jurisdictions, as a form of sort of a stick to promote vaccination, have said, okay, if you're going to embark on this path, eventually you will be paying for those tests yourself?
And I'm sorry, I'm not clear on the question of who are you suggesting will be paying for it?
Well, right now the federal government is, but eventually the supply of rapid antigen they've acquired will run out. And or what are we committing ourselves to here?
It's certainly a possibility, but I don't think it's a probability. The antigen supply chain for the testing capacity has been quite robust and improved significantly over the last year and a half. If it becomes cost prohibitive, we'll absolutely review the costs and the program. This is our initial rollout of immunization policy. It's our hope and goal that the number of tests actually decreases over time as more individuals realize the benefit of a safe and effective vaccine as the means of reducing the risk in our communities and preventing transmission. We need the highest rate of immunization in our communities to best protect our children, our schools, as well as those that are vulnerable. So absolutely we'll assess costs, we'll monitor the utilization of the testing, we'll monitor how effective it is as a strategy, and we will review our policies on an ongoing basis to ensure it's meeting its aim.
Next question.
Your next question comes from Holly Mackenzie-Suter with the Canadian Press. Please go ahead.
Hi, wondering about the school policy, if the proof of vaccination or testing requirement in schools would apply to eligible students older than 12, or if the province is considering that at all right now.
Yeah, thank you for that question. I think it's prudent and reasonable to start looking at an immunization strategy for students. If we're applying it for the workforce, we want all of them to be safe in the school environment. So we're in active discussion with the Ministry of Education on having an immunization policy. Typically, if we follow the Immunization of School Pupils Act, which is in place in Ontario, it would just mandate that students' parents report the immunization status of their children and or take an educational module. So we're reviewing that. I think it's prudent to include that in the suite of policies, that the immunization status of children be reported to their local public health agency so we know in advance the immunization status of students, classes, schools, school boards. It helps us with from a local public health agency for planning and responding to outbreaks in those settings and would speed up our ability to protect the classroom, the school, the student, and the family involved.
Follow-up?
Yeah, thanks. I'm wondering also about, we're hearing from the government that they didn't go with mandatory shots for hospital workers because of the staffing shortage that's in that sector. So I'm wondering if staffing levels also contributed to the decision to not make the shots mandatory for schools and childcare, and if you think without those staffing challenges, making shots mandatory would be more effective at controlling spread in those settings.
So the approach in Ontario has always been, and it started in the long-term care sector, to have show us that you've been immunized and or have an exemption and or attend an educational event and or have a testing strategy. So what we wanted across all domains of government is have a consistent approach. So we learn from the long-term care sector. We're applying it in multiple other sectors now. That's been also consistent with the approach of the Immunization of School Pupils Act. Report to us your immunization, or have an exemption, and or have an educational module, and or be exempt if there's an outbreak. So we want consistent and persistent approaches in policy to our immunization strategy. This is the Ontario way. It's been our way as long as I've worked in public health, and education has always been a strong component of our policy. Clearly, it's my hope and my wish that every Ontarian take advantage of these safe and effective vaccines. This is a reminder that it is our best means of limiting the spread as we go into the fall and winter of Delta. I hope this suite of tools that Ontario has developed on immunization policy will be a call to arms, will increase our immunization rates across Ontario. I'm going to be following that very closely over the next several weeks to see how effective these policies are at implementation, as well as protecting our patients, our schools, our colleges and universities.
Next question.
Your next question comes from Lorenda Redikoff of CBC. Please go ahead.
Hi there, Dr. Moore. Similarly to what Randy asked at the beginning there, you're the one responding to this, and we don't have anyone from the government, no elected official. Why is that, and how much of this is your recommendations, and how much of this comes from Cabinet?
So directives, in particular relating to acute care, chronic care sectors, would be coming from my office, the Office of the Chief Medical Officer of Health. I had discussions last week with the Premier. We've briefed Cabinet last night and got approval. But this suite of tools we've been developing since I started in this office. And when we saw the rate of Delta increasing, the transmission increasing, and the slow and steady rise of cases across Ontario, I made the call to the Premier and said we need directives in place immediately to best protect us in the fall. There was no disagreement. There was very good unanimous support from Cabinet, and hence the need. I don't think there's a need to have a minister here today, given that these are directives from my office.